I've emphasized recently that our men and women in law enforcement deserve Arizona's recognition and praise for their service on the front lines. We're here today to proudly share an example of the amazing impact our law enforcement officers have every day on the job. Last week, one of our DPS detectives sprang into action and saved the life of an individual who was unconscious and not breathing as a result of an opioid overdose. Detective Tony Morales was trained on and supplied with naloxone as a direct result of our state's efforts to combat the opioid epidemic. Before we hear more details surrounding last week's event from Colonel Frank Milstead, I want to recognize Detective Morales, who is here with us today. Detective, your quick and decisive action saved a life here in Arizona, and for that, our entire state is grateful. Thank you. We're attacking the opioid epidemic from all angles, from drug interdiction through the Border Strike Force, which Detective Morales is a member of, to the treatment of and prevention with the Arizona Opioid Epidemic Act. And the use of naloxone by our law enforcement personnel is having a significant impact in the fight against opioid overdoses. In just a few moments, Dr. Kara Christ will provide more details on that. But first, I want to point out a few other signs of progress that we've made in this battle. Between June 2017 and June 2018, the number of opioid prescriptions filled in Arizona declined 40%, and the number of opioid pills dispensed decreased 43%. In addition, referrals to behavioral health or substance abuse treatments services after an overdose increased from 45% to 73%. This is significant, measurable progress. And with new policies and resources deployed statewide, we are confident these are only the first of more positive results to come. Now I'd like to turn it over to Colonel Milstead to share more about the action taken by Detective Morales. Colonel?
Thank you, Governor. Good morning. Thank you for covering this collaborative piece of police work. It's interesting that when the governor tasked Arizona DPS with setting up the Border Strike Force now almost 3 years ago, we hadn't really looked at the idea that we would also be part of the treatment and prevention piece of this. But the opportunity presented itself with the issuance of naloxone to our troopers, and with the help of our chief paramedic, who's also a trooper assigned to our aviation bureau to train our troopers on how to administer naloxone. The naloxone came to us through the Department of Health Services with Dr. Christ, and in this instance, Detective Morales was out on routine patrol doing his normal work on the Border Strike Force as a detective, part of our criminal targeting unit, and he heard a radio call come out for someone who had overdosed, and nobody had arrived yet. There were no medical professionals on scene. He was the first to arrive, and I don't want to steal his thunder. I'll let him talk about what he was able to do. But the Border Strike Force really has more than just that interdiction piece. It is part of this treatment piece as well, and the prevention piece of trying to keep these drugs out of the hands of kids and other people in Arizona. So without further ado, I will introduce you to Detective Tony Morales. Tony?
Hi, my name is Detective Tony Morales, M-O-R-A-L-E-S, and I just briefly want to talk about what happened on August 8th of this year, around 6:30 p.m. I overheard Douglas Police Department sending officers to the area of Purteville, just north of Douglas, and they were sent to a male subject, unconscious, not breathing. And upon arrival, the first detective called out for somebody with Narcan. I was probably less than a mile away. I went to the scene. By this point, the dispatcher, Lucy Perez, she had the passenger who was in the car. The guy that I gave him the naloxone was actually driving, and he passed out. The passenger took control of the wheel. He steered it to the side, applied the emergency brake. Dispatch had him pull him out of the vehicle and lay him flat on his back. Detective Ray Miramontes from Douglas PD was doing chest compressions when I arrived. He was, when I got on scene, I didn't think this subject was alive. He was blue, he was purple, he was unresponsive to anything we were doing to him. We had a lot of people in the neighborhood coming out to see what was going on. I administered 2 doses of Narcan, and after the second one, the subject just inhaled a big gasp of air. His eyes opened bright, wide open, and he went back to sleep. And within a minute or so, medics arrived on scene and threw him into the ambulance and took him to a landing zone. Upon further investigation, we learned that the subject had taken some Percocets, some Xanax, and wouldn't admit to anything else, however. By the time I drove from the scene to the landing zone, which was a couple of miles, I realized that the helicopter wasn't there yet, so I went to the back of the ambulance and I told the paramedics, he took Xanax and Percocets. The paramedic looked at me, he goes, "Yeah, we know, he told us." I kind of looked surprised to him, and he goes, "He wants to talk to you." So he opened up the back of the ambulance, and the subject was wide awake, staring at me, thanking me for giving him the Narcan. Like I said, the subject was lifeless, and to see him in back of the ambulance, looking at us and talking, it was amazing. I thought I was looking at a ghost, but it was truly amazing what Narcan did on this day.
Hi, my name is Dan Millen. I'm the Chief Paramedic for the Aviation Bureau. One of my responsibilities as the Chief Paramedic is I'm required to sit on the DHS EMS Council. And the EMS Council over at DHS developed this Narcan program for EMTs and law enforcement officers to be able to carry and administer the medication. So I took this back to my supervisor. The aviation commander took this up to the executive staff at DPS and for information and also directive if the department was going to decide to opt into the program. So with the support of DHS, our medical direction over at Honor Health and the AMR Ambulance Company, we set off to start implementing the program. Trooper Paramedic Neil Williamson and I created a lesson plan that involved the DHS curriculum. We ordered the medications, and then we also then got started with the AMR Ambulance Company to start administering the training for CPR and the naloxone. So currently, we have trained 432 DPS employees with this law enforcement naloxone program. Our medical director over at Honor Health has required all the participants of this program to maintain AED, CPR, Heart Saver certification, which obviously is a very good thing. So along with his guidelines, all the DPS paramedics and troopers in the agency also are required to report any instances to where they might have come in contact with the subject of a suspected overdose or an actual overdose like we just talked about here today. And then lastly, the Arizona Department of Public Safety has received recognition into the DHS Public Health Excellence in Law Enforcement Program back in March of 2018. Thank you.
Thank you, Colonel Milstead and your team, and I want to thank Governor Ducey for leading Arizona's efforts to curb the opioid epidemic. As you just heard, in an opioid overdose, minutes matter when saving a life. Our law enforcement officers are often on the front lines protecting our communities every day, and they are the first to arrive to a scene. That's why it was critical to arm our first responders with the opioid overdose reversal drug naloxone. I want to thank Detective Morales for jumping into action and saving the life of this Arizonan. The Arizona Department of Public Safety has been a state leader in our efforts to train law enforcement. Colonel Milstead reached out early to my team at the Arizona Department of Health Services, asking how to equip his officers with naloxone in order to help save lives. Detective Morales is one example of the many officers who are trained to recognize an overdose and supplied with naloxone as a direct result of our state's effort to combat the opioid epidemic. To date, the Arizona Department of Health Services has provided over 6,300 naloxone kits to over 63 law enforcement agencies throughout Arizona, allowing our officers to save lives by reversing overdoses in the field. Almost 1,000 law enforcement officers have been trained to provide naloxone, and to date, they've administered this medication 549 times to 405 people since last June. In all but 9 cases, the individual survived the immediate overdose and was transported to a hospital for further care. That's almost 1 life saved per day since our opioid emergency was declared. Our first responders and law enforcement officers have done incredible work. Since June of 2017, collectively, they've administered over 6,600 doses of naloxone before someone has been transported to a hospital. And we know that these aren't just numbers. These are family members, loved ones, and friends who are alive today because of the quick actions of our first responders. But naloxone isn't available only for first responders and law enforcement. It is available without a prescription to anyone in Arizona through our pharmacies. Getting naloxone into our communities is a critical tool for saving lives. Over the past year, we've seen a tripling in the number of naloxone kits dispensed through pharmacies, resulting in 24,000 kits dispensed statewide to those at high risk for an overdose or their loved ones who can help save them. And as you know, Arizona is faced with an opioid crisis, and the numbers are staggering. Since last June, over 1,600 suspected overdose deaths, 10,000 overdoses, and 900 babies with neonatal abstinence syndrome have been reported to the department. In response, we've taken significant action and become a national leader. Over the past year, Arizona has seen significant measurable progress. As Governor Ducey stated, the percent of patients receiving referrals to behavioral health services after an overdose has increased from 45% to 73%. And the number of opioid prescriptions filled has declined by 40%, and the number of opioid pills dispensed has decreased by 43%. And our work there hasn't stopped. There's been a 62% decline in the number of patients potentially doctor shopping. And this is the result of many policies and resources that have been deployed statewide. A couple of highlights include over 300 callers seeking advice about prescribing opioids or caring for patients with opioid use disorder have utilized our free 24/7 statewide consultative opioid assistance and referral line. Over 1,000 doses of naloxone have been provided to the Arizona Department of Corrections to pilot a program that provides naloxone for individuals at high risk of overdose who are released from our correctional facilities. A $10 million investment has been provided to enhance access to treatment for uninsured or underinsured Arizonans. A Good Samaritan law has been implemented to allow people to call 911 for a potential overdose. And our recently passed Arizona Opioid Epidemic Act has many policies aimed at preventing Arizonans from experiencing the devastating impacts of opioid use disorder while still protecting our chronic pain patients who are currently taking these medications. With these new policies and resources deployed statewide, we are confident that our successes are only the first of more positive results to come. We want to thank Colonel Milstead and his team at DPS and all of our participating law enforcement agencies for being leaders in this initiative and protecting our communities. We appreciate all you do to keep us safe. Thank you. Governor Ducey?
Thank you, Director. Questions?
Dr. Chris, I do have one question. I wanted to throw out a lot of numbers here. Come on back to the mic. This is much easier.
Sure.
You mentioned a 62% decline in the number of patients who were doctor shopping. How do you determine what didn't happen? I'm a little curious there.
So there's actually a report that is put out by the Board of Pharmacy that looks at the number of patients who are getting 4 or more prescriptions from 4 or more pharmacies within the past month. And that number, I don't know the exact, we can get them for you, Howie, but has declined by 62% since we started monitoring last June.
Governor, you mentioned the number of prescriptions that are in people that using those types of numbers. You had a report that just came out a couple of days ago that shows that opioid-related deaths are still on the rise. How would you measure that as a success if more people are dying?
Well, we've said that there is a real challenge here. This is why Arizona led with the Opioid Epidemic Act last January. This isn't just happening in Arizona. This is happening all across America. So we're combating it aggressively. We're putting together policies that can help and reduce. And you're seeing today demonstration of lives that have been saved. But yes, we have an addiction issue in this country, Dennis.
And I believe that report also said a third of those
when someone is addicted, they will make poor choices. We not only see heroin, but we also see fentanyl. And Detective Morales is a member of the Border Strike Force, and they have interdicted millions of hits of heroin and over 15 million hits of fentanyl that are not on our streets at this time. It's an ongoing crisis. Other questions?
Well, let me ask you a semi-related thing, Dr. Chris. You're sitting on $44 million in the marijuana fund, and there are a lot of people who suggest that perhaps medical marijuana might provide an alternative. Even you've talked about that. When are you going to do something with the $44 million, either to reduce the fees to make it more accessible, or something? $44 million for a program that's costing you $7 million a year. Even the governor can't boast of that sort of surplus in the government. Come on down and tell us what are you going to do with that money?
And thanks, Howie. That is something that we are exploring with the Attorney General's office to look at ways that we can utilize that. Luckily in Arizona, we do have a medical marijuana program, so that is an option for our chronic pain patients to explore, but that's really a discussion that a patient needs to have with their healthcare provider. There are many tools in the chronic pain toolkit. If you go to our website at azdhs.gov, we've actually got a chronic pain self-management website where we talk about the different tools. But thanks, Howie.
Just in closing, I would tell you this, with all the work that the Border Strike Force does, with all the policies that are coming out of the governor's office, with the work that DHS does on a daily basis, the piece that's going to change this is the education piece and the parenting piece and the decision-making piece that we have to interact with a generation or two of children and get them to make good decisions, not to insufflate white powder, not to stick needles in their veins with substances that are completely addicting and will change or ruin or end their lives. So as you go forward and talk about this problem, I think it's really important that we talk to kids and that your message from the media gets out to these children as well. That's what's going to change a generation of overdoses. But thank you all for being here. Thanks for coming to the Arizona Department of Public Safety.